Hello, we have Dr. Nikko here today to answer some questions regarding liposuction. Hi, Dr. Nikko.
Hi.
Thank you for coming in today.
My pleasure.
All right, I want to go with our first question from Kim, who says, I'm considering liposuction. Online, I've read there are multiple different types. What types of liposuction do you perform, and why that procedure?
Okay. Hi, Kim. That's a common question because there's a lot of different technology out there. As you know, there's smart lipo, there's Vaser, there's this pure-tumescent liposuction. You may have heard about power-assisted liposuction. There's ultrasonic liposuction. And so it can get confusing. But what I can tell you is that it boils down to the tumescent liposuction technique. And as wonderful as all these different technique may be, I can tell you that I go to an annual liposuction conference every year, and I talk to people who've been doing this. I've been doing this for 15 years, and I talk to people who've been doing this for over that 20, even 25, and they say that even with all these new techniques, it boils down to the individual person that's doing the liposuction. The technique that they advertise that's gonna, tighten your skin more, it's gonna give you less bruising and easier recovery. A lot of that may sound good, but I can tell you, it really does boil down to the person doing the liposuction, and being the results you get is just depending on how meticulous your surgeon is in removing a smooth layer of fat and leaving a smooth layer of fat behind and creating the right shape. Liposuction takes time. That's why a lot of surgeons, when they do tummy tuck, they don't do liposuction, because sometimes, for me, liposuction takes longer to do than a tummy tuck, because you're removing a thick layer of fat with a small cannula. And so you're in there working 3 hours easy, sometimes up to 4 hours or so on a few areas, and you have to be very careful to get the smooth contour and the right shape. So don't focus on so much on the technique, but I think focus on looking at the before and after, looking at what kind of results you get, because your surgeon can use any technique as long as he or she is good at it.
This next question comes from Denise, who wants to know, will I have to go under general anesthesia?
Yeah, Denise, a lot of people don't want to go under general anesthesia, and that's I can certainly understand that. But there are a lot of people who can't handle doing liposuction under local anesthesia, because if you're the type of patient who don't mind discomfort, don't mind being awake when we're taking this cannula and we're going back and forth and we're working underneath, and it feels kind of strange, and sometimes we hit a spot that's not completely numb and patients jump, and so it's not for everybody. I prefer general anesthesia. It allows me to really be aggressive and create that beautiful shape and rest in comfort. When patients are awake and I know that they're kind of hurting a little bit here and there, it doesn't really allow me to focus on working on getting the results, focus on the surgery, and not so worry about, because I don't like seeing patients in pain when they're uncomfortable. And sometimes you hit a hot spot and it all tense up. But there are small cases I can do, definitely, little facial liposuction, small little love handles, maybe a little saddle bags. You can do that under local anesthesia. But in general, most of my patients, at least, come in, and there are a lot of areas that they're concerned with, and they want to knock it out all at once. And you're just so much more comfortable under general anesthesia.
Okay, Rachel asks, if I get liposuction, will the fat come back after a procedure? And if so, how long after?
Yeah, that's great. Another very common question. We would love to tell you that once we do liposuction, you're good and go, you look beautiful, and really just go out of town and party and eat whatever you want, no exercise, and you be good the rest of your life. But unfortunately, that's not the case. But the area that we worked on with liposuction, let's say I did liposuction on a stomach area. Well, the fat will not come back in the stomach area if you were to gain weight. You'll go to your waistline, it may go to your arm, it may go to other areas where you store your fat. So you don't want that. You don't want a small stomach and big arms and big thighs. So you definitely want to take care of yourself. So to answer your question simply, the fat does not come back in that particular area, but it will come back in other areas. And so I tell patients, look, if you're not willing to take care of yourself, then there's really no point, because you're going to look great for a while, but it's really up to each patient to kind of maintain it.
Well, that makes sense. And it's a motivator for people to stay healthy, for sure.
Yes, definitely. And I think it's, you know, a lot of my patients that I see, it's just that they've worked out a lot and they just can't get rid of the stubborn fat after pregnancy. And some people just don't. I mean, I've taken care of trainers in classes who, you know, people who give classes for exercise, and they can't get rid of the fat in the inner thigh no matter how hard they try, or maybe a little bit in the arms. And so it just happens to where they had care of their stubborn fat. But a lot of my patients, you know, they just have a lot of fat pockets everywhere, and they just, it's so hard to see results. So I tell them, you know, I'm going to kind of really work hard at getting you close to where you need to be, and then they look great, and then they feel better. So that way they get back into the gym and they feel better. It's easier. It's not like this big mountain where it's just they're getting nowhere. Once we get them closer, they just take off and really, really do well.
Okay, this next question is from Linda, who says, I'd like to get liposuction, but I'd like to know what happens if I continue to gain weight after the procedure.
Yeah, again, back to the question the other patients had. If you gain weight after, then you are going to gain other areas. And most importantly, if I remove fat from patients, you know, abdominal area, you know, which is the fat above the muscle, and maybe the hips or something, and the waistline, the thighs, and they gain weight. Well, there's actually fat underneath the muscle, and that's the fat that's around your organ. That's the fat that's dangerous to your heart. And so you definitely don't want to gain weight after a liposuction. And then if you do, then you know, once you lose it, I mean, you can lose it pretty easily, but you gotta like really keep an eye on it. Mm-hmm.
This next question comes from Janet, who wants to know, how long will it take me to recover? Now,
as simple as that question may seem, it's a little bit difficult to answer, and I'll answer when patients ask that. That's why our consultation takes a while, because you know, you can tell a patient a quick answer, and then they just don't have the right information, and then they don't plan accordingly. So let me answer this question in a way that briefly, but a little bit thorough. And now, in terms of liposuction, I tell any patient, when you have liposuction, it takes 6 months for you to feel completely back to normal, because, you know, within that layer of fat, there are a lot of nerve fibers. And so when we remove those nerve fibers, it takes time for them to return, to regenerate. And so they're going to have numbness, they're going to have tingling sensations, and sometimes they have a little shooting pain here and there. And all that takes 6 months to get better. Now, with that said, when will they feel well enough to, you know, go back to working out? Well, of course, it depends on how many areas of liposuction they do. But typically, I tell you that in terms of going back and doing light cardio, you're talking about, you know, 1 or 2 weeks. Heavy lifting, running is a lot of jarring. So that typically takes at least a month for them to do, because they're very sensitive. When would they feel well enough to, you know, take a great vacation? I tell them about a couple months out, because a couple months out, they're about 80% healed. Not completely there, but 80%. So I hope that gives a little bit of a guideline. And most people, if they have this pure tumescent liposuction, they typically take anywhere from 3 to 7 days off from work, depending on the amount of areas.
That's great to know. Well, this next question comes from Betty, who says, I'd like to get an idea of what it will cost before coming into the office. How much do you charge for liposuction? And do you take credit cards, or do you have payment plans?
Yeah, Betty, great question. You know, obviously we want to help patients understand the costs involved before coming in, because if it's something that, you know, much more expensive than they thought, then we definitely don't want to surprise them. But I can tell you, breast augmentation is pretty clear. there's a pretty set fee for almost everybody. But when it comes to liposuction, it's a little different because everyone has different amount of fat, the areas, and so, and the look they want. Some, I do a lot of Brazilian butt lift, and so it takes a lot of time to contour that waistline, but you're probably looking at per area. So let's say on average, if you're looking at the stomach, I mean, you're probably starting out. If you want to do this right, it takes time. I've seen people trying to do, oh, I got this doctor to do for a couple $1,000 for a stomach. Well, liposuction is one of those things you can go in and hurry up through, and then the patients end up with lumpiness and scarring, and that is very, very hard to fix. So liposuction is one of those things that you gotta really, really try to get right the first time. I mean, you can do minor touch-up and such, but if you get it right the first time, it's awesome. If you mess up the first time, you got scar tissue in there, and oftentimes you cannot fix it. I'm sure a lot of people, remember Tara Reid, I'm sure she went to a great surgeon and she got the dimpling. I mean, those are the kind of things that can happen if you're not careful. So on average, I would say the stomach, you're probably looking at $3,500, $4,000 starting out, and you add the waistline to $3,000. So it's per area. And each area varies from a couple thousand to up to $4,000, depending on the area and the size of the area.
Dr. Nikko, those touch-ups you mentioned, are those generally under local anesthesia?
Yeah, that's the great thing. Now, touch-up can be done under local, and because it's a much smaller area, so it can be done under local. And one thing I know you asked the previous question was that we do take a payment plan for some of the for the surgery, and so our office can work with you on that. Mm-hmm.
Okay, great. This last question comes from Lisa. And she asks, what type of scarring can I anticipate, and where would the scars be located?
Yeah, okay, so liposuction is not, again, we don't cut, but we have to make those small little holes for the cannulas to go through. Now, I use small cannulas. I use, the most I use is a 4 millimeter, which is 2/3 the size of a pencil eraser. On average, I use a 3, so between a 3 and a 4 millimeter. So those are tiny little holes, okay? Now, afterward, those little holes will heal on itself, but still, they're little marks that will take, still, any scarring takes a year to look great. So you have to be patient with that. Of course, we try to hide these little holes in areas that are not visible while you're healing, so that way you can still go out and wear a bathing suit and not seen. The number of holes will depend on the number of areas that you see. For example, if you're doing just the outer thigh, I can do it with 1 incision. But if you're doing the stomach area, typically you're looking at 3 different ones down below. Okay, now these are small little one. Now of concern is if you have a darker skin type. Now these darker skin type patients can have, these holes can turn dark, and so it takes more time to heal. And they have to understand sometimes it can be permanently dark, so we try to keep them small. And if I see a patient with darker skin type, I try to not do through so many little entry sites. And I use even smaller cannula, and I'm a little bit more aggressive with treating their scar at the beginning, at the onset, so they heal as nicely as possible.
If it does turn out that their scar is darker, do you do anything further to alleviate that? Is there a cream or anything that can help?
Yeah, there's bleaching agents that can work sometimes, and there's other creams that can work. But sometimes the patients with really, really dark skin type, it's just really hard. But those are the few patients. The majority of patients, I can tell you 95% of the patients don't complain about the little incisions. 5% of the time, I do get patients who are, perfectionists, who a little mark kind of bothers them, and so so that's why it's very good to talk to each patient. And one of the things we try to do at our consultation is really explain to patients what they can expect, know their expectations, and that way they come in knowing everything. And the more patients are educated, I think the better chance they'll have of being happy.
Well, thank you so much, Dr. Nikko, for taking the time out to answer these questions about liposuction.
Yes, thank you very much. And I would love to, if you have any more questions concerning, liposuction, what kind of results you get. We try to do photoshopping to show you what kind of contouring we can do to help you understand the idea of the shaping we're trying to do, and you know, give you understanding of you're a good candidate for liposuction, to make sure that we meet your expectations. If you're interested, just give us a call, 713-960-1311.
You can also scroll down to the comments section of this video if you have any further questions, and Dr. Nikko will answer those for you as well.